Okay, Darren, so that's a photo of your chest x-ray.
It was during a third-year placement in rural Tasmania that Dr Alexandra Zeidel decided she wanted to be a GP.
I was just blown away by what those GPs were managing and what they were doing in that rural location. And at that time I thought, that's what I would like to do. That's the kind of doctor that I want to be.
But only 15% of final year medical students in 2019 listed general practice as their first preference specialty future, the lowest number since 2012. It's one of the factors causing a shortage.
Having less GPs in our local area means that we do have to do more for our patients. We have to manage more patients with less time and less resources than we would have previously.
And with appointments hard to come by, it can also affect the health of the community, especially in the regions.
They often end up accessing A&E. And the other thing is they stay at home till they get more unwell, and then they have to call the ambulance to get some help.
There are around 60 GP positions vacant across the state, according to the RACGP. Most are in regional and rural areas, but 19 are in the greater Hobart area. Some say the Medicare rebate, the amount of money your doctor earns after bulk billing you, needs to be higher to attract more doctors into the profession.
So it is a more sustainable business model for someone to be a GP, for someone to own a GP practice. At the moment, these practices are running on the smell of an oily rag.
They've got a big HECS debt, they've got a partner, they've got children, and they're looking to buy a house, and then they decide, do they want to do general practice or they want to do one of the other specialities where you earn 2 or 3 times as much.
Over the years, there have been many incentives put in place to attempt to fix the shortfall. Last year, the federal government announced it would wipe the HECS debt of GPs who worked and stayed in regional and remote areas like here in Huonville for a specified amount of time. Despite the challenges, Dr Zeidel is proud of the path she chose.
I think over time it's generally been the relationships that I've formed with my patients that I've appreciated the most.
Alexandra Alvaro, ABC News.